Despite the Albanese government promising to have urgent care clinics up and running by mid this year, their locations are yet to be finalised. The Department of Health has confirmed it's still working with state and territory governments 7 months after the government committed to the project, which aims to alleviate pressure on emergency departments. Almost a third of electorates were promised a clinic during last year's election. The opposition is demanding Labor issue a more realistic timeline and not walk away from its promise. Joining us live now for more on this is Dr Nicole Higgins, the President of the Royal Australian College of General Practitioners. Dr Nicole Higgins, thank you for your time this morning. Is it frustrating that these locations haven't been finalised yet?
Good morning, Gabrielle. It's challenging at the moment. The state health systems are really struggling financially, and they've called on for Medicare reform, and the demands on the system just continue to increase. So patients are really struggling to access care.
The opposition wants the government, I suppose, to not walk away from its promise. Is that how you feel? It's walking away from its promise?
It's struggling due to the inadequate funding, and what we're seeing is that it's actually patients who are struggling to access that after hours and urgent care, and that's because Medicare has not been properly funded. These urgent care clinics, as they come online, are purely to keep people out of the emergency departments, and what we're finding is that there is a flow-on effect because general practice is struggling. It's putting a really big impact on the state hospital system.
So talking about increasing funding, do we need to be paying GPs more? How much more should they be paid?
So Medicare has been chronically underfunded and undervalued by successive governments, and Medicare is the rebate that patients get when they go and see their GP. So it's actually the patients who are out of pocket, and what we're finding is that practices are reducing their bulk billing, and that is because the Medicare rebate simply hasn't caught up with the cost due to the freeze, and they're either seeking their care elsewhere, such as the emergency departments, and that's putting a huge pressure. And what's now happening is general practice is struggling because we don't have the capacity to see those patients either due to the funding.
Should there be incentives to encourage doctors to bulk bill patients?
So the bulk billing rate is declining significantly. So we have asked the government to immediately increase the bulk billing incentive for patients.
Okay. Looking at this more broadly, what else should we be doing to alleviate pressure on the system? Should we also be increasing university placements?
Yeah, so we want to increase the pipeline. We know that that only about 14% of medical graduates want to become GPs, and it used to be about 50%, and that's because it's undervalued and underfunded. We're finding that doctors and GPs are burnt out and are leaving the profession, and also the doctors who are from overseas who want to come into the country are finding it increasingly difficult. So there's multiple issues around this, but what's at the base of it is the underfunding of Medicare. What the other concern is, and this has been raised in Queensland over the weekend, is if the states want to improve the general practice system, we really need to look at payroll tax, and that's something that's going to increase the costs of fees for consultations and reduce bulk billing even further in the states.
What about telehealth? I know it's not the gold standard. I suppose that is going to see a GP face-to-face, but should we be investing more in telehealth? Is that not the way of the future?
Yeah, look, telehealth, COVID changed so many things about how we do things, and telehealth has provided options for patients who really struggle to get out of home, who have access issues, mental health issues. For our rural patients, it's been a game changer. So telehealth needs to continue.
Dr Nicole Higgins, President of the Royal Australian College of General Practitioners, thank you so much for your time today.
Yes, thank you.